My name is Dr. Rahul Shah. I'm a consultant gastroenterologist, hepatologist, and interventional endoscopist. Fatty liver is a condition where you have excess deposition of fat in the liver parenchyma. In the liver cells, you get excess fat deposition. So, this is a very common condition to people of young age, even adolescents, and older age people. As this condition become very common due to the way we live, the way we eat, the way we drink. So people tend to have a high carbohydrate diet, high fat in the diet. They are limited in the exercise that they do on a daily basis. And there's excessive consumption of alcohol in some section of people, along with high tendency of people with obesity, diabetes, blood pressure. These things predispose patients to having a fatty liver. So fatty liver can also be caused by multiple other reasons. Of course, there is, as I mentioned, diabetes, blood pressure, obesity, alcohol. Whilst we find that fatty liver is very common in the young adult population, and equally common in the older people, but what we do find is that even people who are adolescent, young children, who have obesity, who have childhood diabetes, who have unrestricted fat and carb are getting more tendency of having a fatty liver. So you find patients at a younger population with fatty liver. We find people who are even young teens to young adults with obesity, diabetes, blood pressure, excess alcohol intake, excess carb and fat intake, who are getting more and more tendency towards fatty liver. So we diagnose people at a younger age. We diagnose people early. And this is a real problem for the future generation of our continent. Fatty liver, it actually has no symptoms whatsoever at all. So liver disease in general will not have any symptoms until the end. So I always tell people that liver disease is on the exponential rise in the world. And one of the key problems is that detection and symptoms are often delayed. So until the liver is fibrotic, scarred, and cirrhotic, people do not present to us with any symptoms. A very, very small fraction of people who discover fatty liver while incidental diagnosis for other problems like gallstones, kidney stones, and they do a sonography which picks up a fatty liver. But when fatty liver has caused into fibrosis and cirrhosis, then people tend to get jaundice, which means yellow discoloration of the sclera, yellow discoloration of the skin. People get fluid accumulation in the liver. People can get bleeding. People get other symptoms like tumor formation. But that time, it's often late for us to help these patients. So early diagnosis is a key in most of the population. We do have to be wary of our health, be proactive in doing biochemical monitoring, doing sonographies, doing fibroscans, and being aware of our food and environmental intake as well. If you've been diagnosed with fatty liver, first of all, we need to know a number of things. So whether you have concomitant diabetes, whether you are taking excess alcohol in your normal day-to-day intake, are you having excess carb and fatty meals? Are you obese? We need to find out a number of things. Along with your personal hygiene habits, food habits, we do need to investigate most patients with fatty liver. So we would normally start with a simple ultrasound, and we try and grade your fatty liver from grade 1, 2, and 3. So depending on grade, we do offer further testing. So we would like you to have a liver function test done, which is a blood test where we monitor your SGOT-PT levels, we check your protein levels, we check your bilirubin. Alongside, there's a specialist test available called a fibroscan. A fibroscan is a very good way to detect early problems with the liver. So if you have excess fat in your liver, if you have any fat-induced scarring of the liver, the fibroscan will be a very, very good tool to pick up problems early on. Once we detect that you do have a fatty liver, we would be happy to give you advice. So you need to make sure that you have limit your alcohol intake, exercise regularly to make sure that you do not increase your weight, monitor your diabetes sugar levels, monitor your lipid levels, monitor your blood pressure. And of course, a very, very good dietitian would guide you on the best foods to take for your fatty liver. Fatty liver is not a disease process. It's a condition where there's a pathological deposition of fat in the liver. So I would always tell my patients it is treatable, not curable. So when I say treatable, is again that there is no particular pill available to reverse the fat in the liver, but there are medicines available which help to remove the fat in the liver. The medicines available to control other factors associated with fatty liver. For example, if you have a high cholesterol level, high triglycerides, and abnormal lipid profile, you can use medicines to lower the cholesterol, lower the triglycerides, and improve your lipid profile. There are medicines available to control your sugar, which would definitely help your fatty liver. And there's a lot of research going on in the world regarding what the next best drug for preventing fat accumulation in liver, for preventing fat causing fibrosis, and preventing cirrhosis. So a number of drugs like vitamin E, omega-3 fatty acids, and other drugs have been researched and do help patients with fatty liver. Fatty liver is more than likely a benign condition. However, a subset of population would develop fibrosis and cirrhosis, and in those patients, it can be a serious condition, of course. Now, very hard to predict which person who has a fatty liver would progress to fibrosis and cirrhosis. So I always tell my patients that you should proactively monitor this condition. You should make sure you follow the advice given to you by a doctor to treat this condition, because if left unchecked, untreated, then the condition would definitely progress in the future. Prevention is definitely better than cure. So I would be very keen for my patients to follow a diet plan, follow the medications, follow the advice that we give to make sure the fatty liver does not progress from grade 1 to 2 and 3, and then subsequently present in a later age with fluid formation, with jaundice, with unexplained bleeding, etc. So whilst this condition may be benign in a subset of the population, a few patients do present later to our clinic with advanced cirrhosis, where we only can offer transplantation to these patients. As I mentioned earlier, the things to avoid in liver diets, fatty livers, is first of all, you need to limit your carbohydrate intake that you take. Most important. Number two, limit your fat intake. Then we do have to make sure that you do not take any alternative medications. We should also advise the patients do not take artificially flavored tin can products, which have a high salt and a fat intake, preserved products. These substances often tend to cause fat accumulation in the liver, inflammation, and problems. So exercising daily, avoiding excess carbs, fats, and preserved foods will be very useful. Additionally, a vegetarian diet tends to help, as people with non-vegetarian who have red meat often tend to have a much higher tendency, predisposition to fatty liver. Fatty liver can definitely be prevented, but if you start early, so people who are children, our younger generation, have to be taught very important things about regular exercise, regular diet. We do have to educate people about a modest intake of alcohol, and we do have to encourage a good diet which is rich in fruits, fiber, vegetables, good in antioxidants, good berries, nuts, etc. Very good for you. We do have to limit the amount of fat that we intake. We do have to limit the amount of carbohydrates that we intake. If we can follow simple principles of anti-inflammatory, simple diet, then patients would be better off in the future.